Hi, Dawn Stensland-Menti. Welcome to the Dawn Show. We are live and local, so you're going to want to call in today, 866-472-8868. We have in the house somebody who's going to help all of us look younger, look more beautiful, look our best, which is what it's all about. Dr. David Watts, plastic surgeon, is in the house. It's so good to have you here.
Hey, Dawn, it's so good to be here today. Thank you so much.
Well, I mean, I know this is your house. You've been here on WMCN, usually on Wednesday night, 7:30, live every night for nearly 2 decades. So you're a familiar face.
Been a long time. Yeah, we love it here.
Yeah, well, everybody loves you. But everybody in the staff is like picking brains. So I know that you're going to show some before and after photos. But we really are talking about, especially this time of year, I think when people are putting on, the other day I put on a red bikini from back in the day. I was like, oh, and why do we do this to ourselves, right? Why do we save the old bikinis, first of all? But we all do this. So
Sure.
That's when Dr. Watts is a necessity, when the working out just is not going to help us in this battle.
You know, it's interesting. This is really the time of year when we see really a spike in our cosmetic procedures because people are getting ready to go to the beach. They're outside, all the winter clothes now come off. And then what happens, unfortunately, is a lot of those winter pounds that you put on now start to expose themselves in places
yes.
that you really don't want to see. So this is really a great time to get a lot of cosmetic surgery done so you can be ready because the recovery times, Dawn, are just so short. Back in the old days, if you had procedures done, you would be out for a month and you would miss your summer. But now you can go in and a lot of these procedures, such as liposuctions, breast augmentations, tummy tucks, etc. You can get these done, and within a lot of times, if you get it done on Friday, you're back in the game on Monday.
Which is amazing.
Yeah, it's incredible.
So one of the big ones for a lot of people is now they're wearing short sleeves. And so they've got the what you call the bat wings. I know we have some before and after of somebody who says, oh, I can't wear a short sleeve shirt. I've got to wear a sweater or something. So what does that involve to get rid of those so-called bat wings?
You know, actually, it's interesting when you talk about, and this is really an extreme case. This is a young lady who had weighed close to 500 pounds, believe it or not. She had undergone a gastric bypass and lost a tremendous amount of weight, and you can see the excess skin that she had. What we do in the technical name is called a brachioplasty, but basically just an arm tightening. And what we do is actually go and remove the skin and subcutaneous tissue, which is really the fatty area, take that excess skin out. Now, there's actually 2 types of brachioplasties, which most people don't know about. There's a mini brachioplasty, which is the one that you're talking about, and really for women who just start to develop the laxity. And as we talked about off the air, you really have these ligaments that kind of retain and hold things in place. But as you age, those ligaments tend to stretch out and the skin comes down. Now, the thing of it is, with a full brachioplasty, you have to make an incision along the line right here, which is really called the bicipital groove, and then make another incision here in what we call the axilla or the armpit. And so you tighten in 2 directions. You tighten in basically a horizontal direction.
And here we have a graphic up.
Yeah,
so
and there you go, and you
where
can
it
see.
goes.
Now that's the traditional brachioplasty, but the plastic surgeons have gotten kind of slick lately, and we've come up with what you call a mini. Everything's going to
We
mini.
love the mini
We
stuff.
love the mini.
Like we hear about the mini facelift, the mini
right.
this. It just sounds easier.
Exactly. And now with the mini brachioplasty, instead of having to make that big incision down your arm, all we do is make a little incision in the armpit and then just tuck it in this way.
With the help of lipo and just sucking it all in there.
You can liposuction along with the mini brachioplasty or the full brachioplasty, or you can just do the little skin tightening depending on how much fat you have as opposed to how much skin.
And then before the air, I was picking your brains about this, and if somebody wanted to get a twofer, they could suck the fat out of their arm or their tummy or wherever they're doing the lipo, and then you do this thing where you put it like back up in here and give them like little cheeks and fill in the face.
One of the things that Dawn's talking about, and she's just spot on this, is that the new thing that's really hot in plastic surgery now is really liposculpting. In the old days, one of the things that we would do was it was always reductive plastic surgery. What can we take off? But now what we've found out is that we're going more and more into the artistic phase, where we're not just reducing, but we're actually sculpting. Because really, what is plastic
And this is
surgery?
your specialty, that
Yeah.
you're the sculpting guru.
Yeah. Actually, to tell you, my dad's actually an artist, so I think I picked up some of his artistic talent. But the thing that we've developed in plastic surgery over the years is that we're seeing ourselves more as artists using the body as a canvas. And so when you're doing artistry, you're really sculpting patients, and you want to individualize it for each patient. So it's not one procedure fits all. In the old days, and this was the problem with rhinoplasties, they would just do one
the
nose
nose
job.
job.
Yeah, one nose job fits all. But what we're doing now is we're designing and sculpting. So now back to the fat. What we can do is take, and this is the two for sale that Dawn's talking
And let's
about.
talk about the tummy tuck. We can show the tummy
Yeah.
pictures while you're talking about this.
Yeah, exactly. So what we can do is take fat from like the tummy, the thighs, the inner thighs, the outer thighs, the arms, wherever you want it from. Then we actually process the fat, and then we can now inject it into the face. So we can put it here in the nasolabial folds. We can do it in the marionette lines.
Which helps with jowls a little bit, or
It
what?
does. It can help fill up the jowls along the cheekbones. So instead of getting cheek implants,
Okay.
you can now inject the fat to bring out the cheekbones to highlight it. So see, there's all kinds of
Little
sculpting
tricks.
and little tricks. That's right. Plastic surgeons are tricky. We can add the fat in wherever you want. One of the other things that happens as you tend to age is that you tend to get hollowing in the eyes.
Yes.
That's called a tear trough deformity, because that's like where the tears come down. We can fill that out. You can get what's called temporal wasting, where you tend to flatten in this area. We can fill that out. We can highlight the jaw area.
And what's the advantage with your own fat to fill that stuff in, as opposed to people get the derma fillers, which are an artificial filler?
One of the things, and I'm a huge fan of the fat injections, because there's several advantages. One, there's no chance of rejection. So some people who tend to reject the dermal fillers that you're referring to, the allergic reactions, this is your own tissue. So all of this rejection, allergic reaction
And
business.
it's going to stay. It's going to stay in place. All right, when our conversation continues, we're going to talk about butts and boobs. You're going to love it. We've got before and after pictures when our conversation continues with Dr. Watts here on The Dawn Show.